welcome everyone for this webinar. And as you know, the whole world is facing unprecedented challenge to the humankind. Mankind is suffering, and these sufferings can be made bit easy if we organize our show together, we organize ourselves, our activities, and also plan. As of now, when we discuss about things, there would be many situations developing, unforeseen, unplanned, and the territories are uncharted. And in such challenging, difficult times, the most challenging and most essential thing remains how to ensure strategic supplies which keep is going to the last person who is beneficiary of such. Even when things are under lockdown condition, even when curfew is imposed, when nothing is supposed to move out, the only thing move right up to the end of the line is the strategic commodity. And when we talk about strategic commodities, what are those commodities? Minimum basic requirement for the continuance and for the sustenance of life. These may include medicine, fuel, ration, and also consider those commodities which would be required to be moved under such situation to address to the external and internal threats. So we are not talking about only the commodities which civil people, common people think about, their day-to-day requirement. There would be strategic requirement also. The fuel is a strategic requirement. LPG is a strategic requirement. Transportation is strategic requirement. Transmission of electricity is strategic requirement. Beside these, when we talk about lockdown situation, then we also consider that when everything is supposed to be not moving outside, there are essential services to be maintained, ICISSM is invoked, and how those are the service providers which are not mapped already in ICISSM, like security guards, like food delivery guys, like your medicine delivery agencies, they also need to be mobbed in and made available. So with this introduction of the subject, now it is my proud privilege to introduce the panelist speakers. Dr. Parvez Hayat, IPS, he is former DGP of Jharkhand, and he was DGP in BPR&D also. He is a think tank of MHA. He is advisor Center for Climate Change and Disaster Management at JMI, which is a central university. He is independent external compliance monitor appointed by CVC in the State Bank of India and IRCTC. In his illustrious career, he has participated and chaired many sessions on issues and subjects related to disaster management, such as early warning system, disaster-induced mitigation responses and gaps, need for robust interagency and interoperable communication network amongst the responders. He has authored variety of articles such as Smart Cities, a Global Perspective, Role of Police in Disaster Management, and Psychosocial and Victimology of Disaster. In fact, this is for the first time I read in his CV, Victimology of Disaster, and I later on realized when I did a little bit of research that this is a subject which is least talked about and very less known, but it has got a very profound impact on how society interact and the society dynamics are developed. Now I move on to Colonel Sanjay Srivastava. He is chairperson of Climate Resilient Observance or System Promotion Council, CROPC, which is involved in variety of activities. And most important of them are that they are into making network of early warning system, They are into giving early warning guidelines and SOPs. And this is the organization which is operationalizing the technology to augment solution for government, UN and NGO, academia and community. His core area is remote sensing, early warning communication, and technological intervention in development and disaster management. He is convener of Lighting Resilient India Campaign 2019-2021. He is also having a unique program by which not only the states, even at the district level, a network is created and they receive early warning system, not only about climatic change, but also disaster mitigation. He brings his experience from his association with the KOICA, South Korea, FEMA, and Indian disaster management system, through which during war against COVID-19, he is sharing roadmap and strategy for proactive preventive action like financial relief, policy intervention, recovery framework, etc., on time to facilitate better community of operation. Now, with the two panelists already available, may I request all those present here to share their questions, which are available for all the panel, both the panelists and myself. And if they have any personal submission, they can also use the chat button, which is at the bottom of your screen. And you have at the bottom, you have chat button. Here you can share your observation or you can share your question. You can address it to the panelist or to the moderator, which is me, and these will be responded. Now, may I request Dr. Javed to please start his deliberation.
May
Javed, sir.
May I, sir? Dr. Parvez Hayat, sir.
Sorry,
sir. Before we start, sir, I would also before we start, sir, I would also like to introduce that from New York we have Mr. Vijay Narola. He is the CEO of the Optimal Solutions Technology, and he manages the 911 emergency network from New York for USA. So he'll be also speaking, and you can ask, despite so much of drastic stress situation in US, how he is managing the emergency services. Sir, I'll request now Dr. Parvez Hayat to start, sir. Please, sir.
Okay, thank you very much. This is Dr. Parvez Hayat. So, as we know that India is a largely more than 50% populations, they are living in the rural areas, and the whole of India is fighting this disease, and the lockdown period is very likely to be increased, and the hardship is that it was very sudden. So what problems have occurred initially when the Ministry of Home Affairs, they on 23rd and they listed out the essential items. So certain many essential items, there was a lot of confusion among the responders, Even there was a communication between the state government and also within the state government. There were confusion between the, it was left to the superintendent of police and the district magistrate. So there were a lot of confusion. Also the people on the street, the first responder, the police, who were found stopping even trucks and all, which are carrying the certain important items, raw materials, packaging material, and finished product. They were not very sure. So that led to the confusion. But finally, on March 26, the government of India again issued another order to clarify, and they wrote to the Secretary of the State that there should be no restriction on the inter-states transportations when the essential, non-essential. So it is very important, because as we know, the good position is that the warehousing, the Central Warehousing Corporation has sufficient stock. The minimum they are supposed to have the 27.1 million stock, but they have more than 3 times. Means the coming 3 months, there should be no shortage of food grains like rice and wheat, food items, because it's very important, the essential item, the food and rice that can, and then again, the state corporation, they're also sufficient, the stock of food grains we have. The only problem with this facing is that because of the sudden lockdown, the laborers and the daily wages, as we know that all important, the towns, the main township area, 24%, 25% population is the migrant daily wages. I mean the truck drivers. So essential commodities, the important is that just Mr. Tyagi talked about how does the commodities reach to the last mile, that is the retailers, but how will it go? The food processing companies, many of the their owners, they laid off their workers because they thought that it is complete lockdown, that they locked down the company. Until and unless there is a concomitant production of the food processing companies, some manufacturing is taking place, only then the supply will reach to the last mile connectivity we talk about. So that is a problem that because of the migrant laborers, the many laborers, they were also stuck up on the road and they are not available, and many of the manufacturing industries who are making the essential items, either it is like, for example, you will find that there is a very great scarcity of the napkins. It's very difficult for the women to maintain the hygiene because it was not listed initially. Now it has been clarified. Then also the diapers which the children are using. So there is a very large definition of there was a lot of confusion of the essential. What are the essential items? These are essential, I mean, detergent, the sanitizer, but until and unless there is a simultaneous activities of, manufacturing activities taking place in the industries, so which have been facing lockdown, or they are facing the shortage of laborers, because the laborers, they wanted to move out to their home, coming to know that nothing will happen. That is creating the main problem. You just see the standing crop, the wheat and the pulses. So that also there is a problem because everybody doesn't own the larger farmers. They own the machine. They can cut the crop, but they are facing the problem that how to reach these produce from farm to the mandi, because mandis have also closed, and even if they want to carry, there is no transport. So regarding largely because it was sudden, but now largely it has been clear, the government has issued the order that there will be no restriction on the interstate movement of the trucks carrying both non-essential, essential. So those problems have been taken care of. But problem is that even the e-commerce portal, now it has been decided, the government has decided that when there was in the interstate movement, when the GST, that receipt is, that will be treated as a curfew. So that problem is by and large is solved. But again, the manufacturing, distribution and sales of food and beverages and the interstate movement of the goods for the food processing industry, movement of trucks, delivery through e-commerce. So all these problems are taking place, the material, the raw material, the packaging. So rightly you say that how to, there are certain experiments which has taken place. For example, in one of the district collector in Karnataka, in Bangalore, and also in some other states, they have also started the, that online delivery system. In the Bangalore Municipal Corporation has mapped those certain 200 stores or something, and also the online portal, so that the important items are able to, people can use them in the normal phone, not necessarily they can talk, place order, and the food will be delivered. But it is possible only in the important cities like Delhi, Bombay, and other metro cities. So these problems are the people are facing, and also the side by side, the manufacturing, the processing industry, food processing industry. There is a lot of stress by the government that food processing industries should be functioning. But problem is that many of the factory owner, because of the fear of the coronavirus, they are not coming forward. And also the laborers are either on the way stuck up, and also the truck drivers, they are also facing, they are also not available. They have run away with the trucks, and also the fear of the curfew. Many people, they say that, okay, if I go, I recall my own experience then when I had to visit a very, to pick up a medicine which was not available in the nearby area. Certain, you'll see the who are implementing, the police, they don't have the formal training. So they are not allowing, okay, you buy from the nearby market, but even if something is not available, the basic things like either it is medicine or it is grocery, anything. I wanted to go to the CP in Delhi, when I went there, I found that the police at the barricade, they were holding a guy who was showing that he's working in a particular grocery shop, or he was working in a particular medicine shop. They were not allowed to go. Then when I reached to the shop, then there also I was finding that the shop owner was talking to some authorities, requesting them, kindly allow my people to come. How can I work? How can I work in my shop alone until unless you allow? So there has been a lot of confusion initially, but presently there has been perceptible improvement, and the lot of confusion has gone down. But good idea is that one has to go for the out of box thinking, like we talked about, Mr. Tyagi, about using the security. I do not know whether the security agencies, their people they have been advised by the government to not to lay them off, pay them salary, make arrangement. And also in the food processing industry, or the industries where manufacturing unit, where essential items like detergent and the medicine or detergents or sanitizers or soaps, etc., they are making, and sanitary napkins they are making. So how they have to keep their workers in the premises. They have to make available the foods and water, etc. Also, they have to maintain the social distance. These are the problem. The fencing, this definitely something will call out. So I do not know how anybody who is in the industry of security industry, that we do not have the data whether those security men are available, or they have also moved out to their villages, or whether do they have the sufficient transport to carry out the goods from the food industry, wherever the essential items are being manufactured, they can pick up and they can be taken into service for the delivery from the factory to the retailers. Regarding the foods, also there is a problem. The mandi is faced. Many districts, magistrates are facing the problem how to carry the from the food from the state warehousing to the mandi, and mandi to the retailers. There are a lot of problems. You'll find that many mandis, they are not operating. They're operating hardly 10 to 15%. So 3 months. So far the food is concerned, there will be no problem. Government has sufficient stock of wheat and the rice. And also, so definitely it is has to be open governance, where the NGOs and charitable organizations and the religious organizations, they have to be, and other volunteers like civil defense volunteers are being used largely. So it is also creating some kind of a job opportunity for them. So how security only these persons who are dealing with the security can tell us. And that's what I wanted to speak about the present situation. Mr. Sanjay.
Hello.
Yes, Sanjay, sir. Can you hear me?
Yes, I can hear you, sir.
Now, you can start on your deliberation, and there will be, in the meantime, few questions and a few points raised. Let me go through it, and after your deliberation, I will have those questions answered, and either you or anyone can answer these if they show the willingness. So may I request Colonel Sanjay Srivastava to start your deliberation, please.
Thank you very much, sir. Before I want to start, Mr. Vijay Narula, are you there online? May I request if you can raise your hand? Vijay.
Sanjay, I'm here.
Yeah, so before I start, in fact, I would like to request Vijay. Vijay is currently the Chief Executive Officer of Optimal Solution Technology from USA, and we would request him to switch on his video and his audio, and I would like if you can give a brief of the situation about USA, what is happening there.
Thanks, Sanjay. I appreciate it. So we are based in DC actually. Headquarters is in DC, but we are supporting what is called yours India. Here it's FEMA. So initially there was a lot of chaos, and there's still a lot of chaos. But the whole agenda came together when the government took over the reins, the federal government, the central government. Just like the topics that you have discussed, a lot of the issues were happening, they're still happening, because no one has faced such a pandemic at this larger scale. Usually whenever a disaster or an emergency happens, it's localized to a certain area. Or a certain area meaning maybe thousands of kilometers or a zone. But to have it at a national level or a global level that affects the whole logistics of the chain management is another level. So initially the health department was involved, and then came the federal government saw that the health department really could not handle it. So they gave it the reins over to the emergency management department. And now over the last month, what has happened is FEMA has taken over, and they are in touch with all the district managers at each of the states, and they have given them the responsibility to coordinate all activities with the local authorities at the state level. So states are going to the districts are going to the cities are going to the township, and townships are going to the villages, and at that level. So the whole infrastructure has been being utilized to facilitate that. So all the policies and procedures that are being customized at that local level, because every jurisdiction is operating at a different model, and we have to, at the end of the time, reach them. So as the lockdown has happened, one thing is the logistics management is great, but how do you get money to the people that really need to facilitate? And that's where the government has come in. And then we have seen now in less than 4 weeks, the checks have started going out, or direct deposits have started happening to the people's account of $1,200. Especially the daily workers or who are hourly have started receiving financial assistance from the federal government without any assistance. So if you had filed a tax return in 2018, you're already trying to see that money coming in to facilitate it. They started giving out unemployment. So anyone who has been unemployed because of the COVID lockdown, they're starting to receive unemployment benefits. So those are all direct deposits, like a cash card that has been issued to them that they can utilize for online purchasing and everything else. And the online purchasing has really ramped up in the food side, especially the day-to-day necessities that are needed. The deliveries are happening, and those people have been given the exemption to be able to transport the goods in the lockdown. So when the hierarchy has happened a lot, but main thing that's really triggering is the telehealth here. That has really taken a new wave of knowing who really has coronavirus or COVID-19, as we are calling it, and then being able to triage it from the video telehealth perspective. So triaging it, people go online to the mobile phone, the apps are there, you can actually go in and say what symptoms you have, and then based upon the symptoms, a video nurse, a registered nurse or a physician would come in, do a video consultation, and then direct you to the nearest testing center. And those have become online or through a mobile app or through the computer. So the logistics are really forming in place to facilitate the citizens of the country, or not only the citizens, anyone who's a resident right now in the US, to avail of these features and the functionality of the benefits to get tested and go into self-quarantine. And then self-quarantine is the major thing, is awareness. How do you make people awareness? So as soon as we are aware, you can preparedness, it can help you. Mitigation is another thing. And then we are trying to get into the prevention stage now, because we've lost that cycle in the side where we are reacting. Because the cases are spreading, the awareness was not there. Now awareness is being caused through the media. So the government has taken a step back, given the reins to the state level now, saying get ahead of the game and start setting up where OST comes in now. We are supporting now the federal government and the state and local in setting up what they call alternate care facilities. As people who are coming in for treatment, how they have to be treated, and so they do not infect already the people in the hospitals that already have a low level of the autoimmune systems. So the immune system is already down, then the lungs being infected is much greater. So these alternate care facilities are being set up for normal patients to be moved over from the hospitals, so that the hospital wards or the floors can be turned into the negative pressure isolation wards, so they can be contained for the COVID-19 patients. And that's why you have seen the decrease in New York at the Jarvis Center. The number of patients that are going into the Jarvis Center are a lot less now, because they have been moved to the hospitals, and the normal patients are being treated in other alternate care facilities. Sanjay, if there's anything else I can expand on it, otherwise let me know.
Yeah, we would like you to speak about you are at the thick of the COVID battle, and despite that, you are functional in your business continuity. How are you doing this?
So it's a mindset. Everyone had reservations of whether we could really succeed as a company, even with 2,000 people supporting disasters and emergencies at the state level, local level. One thing is having the communication platform, collaboration platform. And the collaboration platform, whether it be Zoom, Skype, Team, Microsoft Team, whatever the platform is very important. And having that, one thing we saw is people were going into an emotional and a psychological to the point of depression. It's okay if you have a family and you're living together with 10 people, you still can talk to people. With a lockdown, the mental capability of an individual is really dropping. So thus the productivity is also dropping now. All the people that really wanted to work from home and wanted to do the telecommuting are now saying we want to go back to work, where the interaction with people has gone away. So what we have started mandating now is video conferencing. Every meeting has to have a video. So you better be ready. So like in DHS, which is the MHA here, they have mandated all meetings from 6 a.m. or 5 a.m. till night will be all video. So you have to be ready. So there is not an option given to people saying, because that's a way of interacting. And collaborating platform is very critical, and essential services are still continuing. We are still allowed to move around because we have those essential certifications, and we are allowed to move around and go for essential meetings to have in classified formats that can really bring in the data to make the right decision happening. So from that perspective, the country is moving from the essential services, because that disaster response and business continuity has been always a priority. However, going to a facility where you have to keep social distancing now has forced us to go into remote operations, operating from various rooms in the same building, in the government buildings, through video conferencing. So I think that has really helped out in a big way. Sanjay, over to you.
Another question I wanted to ask you is the alternate care facilities you say you are managing. So now they have introduced privates also to operate on behalf of the government and create additional facilities.
So here the big difference between alternate care facilities, government has decided that you do not need to be worried about the financial liability of going to the alternate care facilities, because the medical treatment can be rather expensive, and all at the end of the day, private companies are looking at being funded, trying to get the money out of the patients. So the government has taken over their charter. So just like the NDMA goes and sets up charters, and the government comes in, and the army kicks in, and the National Guard kicks in here. So what the government has decided is, rather than putting the pressure of the financial liability on private institutions, the government has taken over that responsibility, which has really taken the burden of the private institution on the P&L. So they are looking at, all the patients are coming in and no revenues are coming. So how do they meet the financial payroll responsibilities? So thus the government's taking over the ACF has helped a big way economically also, and lessening the burden on the private hospitals.
Have you also identified any service as essential service, and a government has issued a notification that all the persons involved in essential service will be permitted?
Yes. That was given. So President Trump declared a war declaration, which means by law, by the Constitution, essential services have to be deemed to be operational 24/7. So factories, institutions like ours that were running at 8-hour, 12-hour days now are running at 24/7 operations under the war declaration. So we are deemed essential.
Like you heard in India, truck drivers have left their truck and gone away. Laborers are not there. How are you overcoming this shortage of workforce, your transportation, your communication needs?
You know, we have seen a rise in the, so I'll tell you perfectly, because we are providing medical professionals, and we have to issue them travel, and the licenses have to be transferred now by the state here. Just like the logistics of just be the truck drivers, because we have to have truck drivers too. Right now we're mobilizing an alternate care facility from south of America to the Midwest in Pennsylvania, and we have almost 16 to 20 16-wheelers and pickup trucks mobilization going on throughout the country. And getting these people is very normal. At the end of the day, all of us respond as people to money. So the rates that we were giving them earlier, say example, we were paying them $20 an hour or $8 a mile to drive the truck. Now we have increased it to 1.5 times to 2 times. And the nurses that were being paid initially $2,000 a week now are being paid $12,000 a week. So the compensation has gone up because of the disaster zones that they're operating in, and that facilitation of the compensation has really brought people to the front line, over and beyond because of the risking of their life. And it's one thing that we have done here, now it's catching up. So now there are daily flights going in from the government to various countries to pick up the PPEs, personal protective equipment. And we're issuing that to all disaster working people to minimize their exposure to the COVID-19. So with that, we have brought in people, and we're putting in the whole country is coming together as a logistics through the various portals of staffing to staff essential services. And we have been able to fill that gap through compensating 1.5 times to 2 times the salary.
Any relief given by the government, financial relief, especially to the people, to the companies, industries who are maintaining the essential services, like paying the salary of the employee, operation and maintenance? So what the SBA has done?
So one of the biggest things that they've done, and it's shocking to see, is called the CARE Act here, COVID-19 Act. And what you're talking about, SBA has done, one of the loans, and they're all forgivable loans. So basically, you take a loan and it's going to be forgiven. So it's not a loan, it's free money. And there's a multiplier factor. So if you have a payroll of not even essential, every company, any small business which is less than 500 employees in a particular area can apply for this loan online through their bank. And within 3 weeks, people are starting to see the money now flowing into their thing of getting the payroll in to sustain the staff without getting the revenues. So say, for example, you had a revenue of saying 50 lakhs per week, or your payroll was. So the government is saying, okay, we'll give you a multiplier fact for the month, that's 2 crores or 200 lakhs. And if it's 200 lakhs, then let's give you the money, a multiplier of 50 lakhs, we'll give you right away. And out of the 50 lakhs, 10 lakhs will be issued to you within 24 hours to sustain your operations, because we have to ramp up. So OST, luckily, since we support FEMA directly, we don't have that issue. We have a direct tie-in with the financial backing of the country. But other companies are going through SBA and these loans and these various financial grants, they're called, and aid is provided to the community, and the word's getting around, and a lot of people are facilitating how to apply and get these loans, or that are going to be forgiven. Mainly first one being the payroll.
What about salary to the employee? How are you paying that?
Oh, they're continuing to be paid. Employees are continuing to be paid just like the direct deposit in their accounts. Everything is continuing. So there's no stoppage, or nothing has stopped from that perspective. Now, what's going to happen is, after how long this lasts, whether it's lockdown lasts for 6 weeks or 8 weeks or 12 weeks, what happens after that when we have to, the whole economy is going down. See, the whole, the country is looking at is not the individual. What is impacting is the states level is going to be much more impacted than the individual level. Because now states do not have the money in their treasury to continue the services they were providing. And that's where the stimulus package is coming in. So federal government is saying, you're not getting the fuel tax, you're not getting the education tax, you're not getting the entertainment tax, you're not getting the GST. So all those tax revenues that used to come regularly to the state to maintain the infrastructure and provide the support services to the citizens is no longer receiving that money. So how will the states operate? So at the end of the day, the essential services have to be offset by the federal government, and the central government has to pay the states now to sustain the service level. And that's why the stimulus packages here are going into, the first one was $2 trillion. Now another one is going in for $4 trillion. And that's something that America is very good at doing, is giving out money to the local level from the state level to the individual level. And they call IAs, individual grants, and PAs, personal assistance grants.
Can I ask some question?
Yeah, please.
I don't know, like because of the rights, like in the US and the Europe, if you see the global picture of the coronavirus effect, like either it is Italy or it's UK, Spain, despite having one of the best medical services. So is it that rights given to the people in US has not, is one of the reasons that they have not been able to enforce the lockdown as strictly as in the states like India and other, states where you have a monarchy, or any other state where the democracy is not so strong? Because why I'm saying so, my son is there in the Michigan, and also my nephew is SFO. So they are saying that like in India, like the police has almost taken over the movement, etc. They are the youngsters initially. Now the US has improving, but because of the youngsters, they were going out and partying out and all that. So the enforcement is not there. Because of that, they have infected their elderly and other people because of the rights. So is there any thought or anything, any law in the US under which you can enforce the lockdown strictly as we are doing in India?
Yes, the laws are there under emergency, especially in the war declaration. They can, that's what gives the authority to the states. So states are also going into an emergency law. So the federal government has said that, hey, we are declaring a war declaration, which gets the whole logistics chain cannot be disrupted. And all the companies that the government seems fit can be repurposed. So that's a war declaration at the central level. At the state level, now the states are doing the same thing. But one thing that they have done here, which I wish they had done it like India, is the lockdown. The lockdown provision in every state is particular to the conformities of the governor of the state, whatever his charter is. In Virginia, the governor said, listen, I'm doing a lockdown, but you can go to work. Now, if you can go to work, what does the lockdown mean? If everyone can go to work, this is not such a big thing, but it's saying we're advising people to stay at home as much as possible. So it's more of a self-driven lockdown than anything else from the government's perspective. The government has said no essential company is to stay open. The lockdown is you're supposed to stay home until you're going in to get essential services, whether groceries, medicine, or moving to a tribe, going to see family, or you can go for walks. So here you're allowed to go for walks. Even California, you're allowed to go for hiking. Now, why is hiking considered essential? That's the nature of the state. So every state has been given that authority by their constitution as it lies in the US, that you can do what's right for your environment, your culture. And that is something that the federal government is saying, listen, certain things the state can rule and govern. But when it comes to medical facilities, the central government is taking over. The federal government is taking over.
Manufacturing facilities like mask, is a shockingly surprised that you have to import the mask and other gadgets from. It means that the United States, the manufacturing of PPE and gloves and other essential gadgets which the doctors are supposed to wear while seeing the patient. So is it that these are not being manufactured indigenously in the country?
Obviously, I think this is widely seen due to the cost of labor in this country. Everything had moved offshore. And I think this, just like 9/11 changed everything for us here, the terrorist attacks, the aviation, the planes going down, September 11, that changed the whole way we looked at doing life. I think this COVID-19 is going to change the way America looks at being dependent globally. I think the globalization is going to really take a step back now from America's perspective. And we are saying is that's where I think when desperation happens, innovation happens. And I think the automation is going to the next level in the creativity here, where the US companies are being told that you will get incentives to set up manufacturing in the US. So and I'll give you a perfect example. We have a device that is coming out of IIT Chennai. And it's the parts were coming from China. Now our company is saying, okay, we don't want to be dependent in China. We don't want to be dependent on India anymore because of the rule restriction of export of temperature monitoring devices from India. Because we have to get a license, we have to get an approval. So we are setting up a factory here, and within 3 weeks, a factory is going to be here that's fully automated. So the creativity that we have brought in, the device prices are going to be down, even lower than China now. Because we are bringing in automated machinery. So we're using actually RPAs and everything else and AI, ML into assembly even. So I think now you'll see a big difference in the coming years, how every country is not going to be dependent upon the others, even when the cost factor is there. And, automation is obviously going to come up with the cost savings.
Very small, another aspect I wanted to know, there is the research from the Johns Hopkins University from US that the research has come out in all over globally that the mask wearing countries vis-a-vis the high mask wearing countries and low mask wearing countries. High mask wearing countries have done better. Like, for example, there was a moment of you protect me. There was very few, the very less number of cases are there. Like in North Korea, South Korea. So they have managed very well. Whereas in the US, I'm told in certain states, in Michigan and Minnesota, very few people they're going out and not wearing the mask. And definitely, as per because everything is known that there was a research that earlier they were saying that the virus, it's not airborne. Now there is a research has come out that it stays in the air. Suppose anybody is moving in the morning walk, anybody has just passed through or coming from the back or passed through 4 minutes before. So the person who is not wearing a mask can get infected. So do you agree that?
Thank you so much, sir. We would like to confine to our topic, sir. Vijay, with your experience in US and you being an Indian, you understand both the systems. What are the lessons for India for preparedness and response? What is good and what is lacking? It's just a general, don't reveal the government things, but just give us a generic.
I think the central government really needs to take the initiative. So what's happened is all the pharmaceutical has been taken over by the central government called the Veteran Affairs. FEMA has taken over all the disaster and the setting up the infrastructure and doing the landscaping. I think the central government has to step up and take reins because capitalistic society usually drives profitability, and profitability usually drives into demand and supply issues in the logistics chain. And the government taking over that reign, that at the helm of it, is very critical. So I think this is what's bringing the flattening the curve now. You'll see this curve flattening in the US, at least in New York and everywhere else where the curve was high. The government has taken over and is demanding certain actions, and certain steps are being taken to flatten the curve. So yes, we will have COVID-19 patients. That's a given. Now we are just trying to spread the timeline so we have less patients, so the infrastructure can deal with the number of patients. So from that perspective, I think the central government in India really needs to do two things. One, help NDMA really get to the grassroots of emergency management and getting to it the proactive nature of thing and getting into the preventative side of saying, masks, if the masks are there, great. If not, put a cloth over your face or whatever the minimum, a scarf can be put on your face, at least to minimize the exposure to others who have a lower immune system. Second, I think the financial support has to be provided by the government. No individual, no company can give that other than the central government. Central government is the only one that has the capability and the willpower to distribute financial support at every level. I think those two are very critical to get through this tough COVID-19 from not only a pandemic, but an economic crisis as well. Sanjay.
Thank you so much, because your FEMA equivalent is NDMA in India. So can you just suggest what specific role FEMA is doing as of now? Because we have people in audience, and we have Professor Sunita Reddy, we have people in audience from these organizations, what FEMA is doing effectively, actionable, which India can imbibe.
So one thing we all know is there's only one organization in every country that can deal with disasters. Because when it's a planned event, every agency can deal with it. And even respectfully, even the law enforcement, what we call the policing, and the largest police force in India is larger than the army in India. But the point being, they cannot deal with disasters, the unknown. And our emergency departments like NDMA and FEMA are geared to be agile and being able to adapt to emergencies and disasters. That's why the reins from eventually rolled up, because no other organization can deal with the pandemic, such a large scale disaster. But NDMA has always been, the DNA is such to be able to evolve to the environment. So I think they are the ones, and they have all the way down to the grassroots, from all the way from the center to the state to the district to the tehsil. They have a process to get to the last person, and that's what they've done here now with FEMA. Emergency management officers are the ones who are actually helping from all 4 stages, from the mitigation, preparedness, being proactive, and then preventive, in that level to get down to the grassroots. So I think that's what I think NDMA has a great infrastructure right down to the grassroots that can really help the country deal with the COVID-19. And that's what FEMA is doing here, including giving the money. So initially they thought the financial department, finance ministry will give out the money, and the treasury from here, it's called the treasury, they'll give out the money to the last minute. No, treasury is giving out the money, but the norms are being set by FEMA. So FEMA is really getting involved, saying where is the disaster, where's the impact, what's going to be the impact. And yes, technology is helping it, but now one thing they have done is saying IT is a commodity here. They're saying is forget IT, we want people on the ground. We want people on the ground. Who has people on the ground at the grassroots level? NDM. They're the ones who can actually bring in the army and the National Guard together to support that, because they're the ones who are actually known for collaborating with other government agencies, unlike any other. So collaborating, they already have the ties to their associates in those other agencies like the MOD. NDMA already has the ties. And if an event, a disaster hits big, they know how to pull in the people to make sure the logistics chain. The largest logistics here happens through what? Army. Army can mobilize any part of the country in minutes to hours to days. And that's what, who works with them? NDMA. So that's what we are doing for critical logistics. We are using the DODs here, MODs, infrastructure to move our logistics. So I think from that perspective, I think NDMA can play a much bigger role in this, and I think that should be highly considered.
Are you using Army under the AMS?
Oh yeah, 100%. 100%. The Air Force is helping out. The C-130 planes are being for the logistics, movement of logistics. Yes, 100%. It's called the National Guard has been deployed.
Okay.
Thank you so much. Vijay, any question would you like to have before I start my session?
No, please start. I'm sorry I've taken up so much time.
No,
but yes, we are really busy and active in the command and control and supporting various states.
Oh, you came online. That itself is a big, service for us. Because
I think we'll all deal with the pandemic. I think this is something we all can do as a team, and that's what needs to happen is collaboration.
Absolutely.
Thank you.
I'm just sharing my screen. The entire supply chain management in India seems to be stopped, and the workforce have gone back. We have our unemployment index, which has gone beyond 23. This has been historical. We never had more than 7.7. That was in January 2020. So we have almost 21 crore of people who are workforce is idle now and economy lockdown. If you see the global economic scenario, which has been projected that our economy is likely to shrink by 1% due to this COVID-19. In the best scenario, it's 1%. And in the worst scenario, it's 0.9%. And so is the impact on India. The key recommendations from the even World Bank deliberations, you see, besides health policies and pandemic and boosting of the healthcare facility, the most important thing is adjust fiscal and monetary policy to meet the COVID-19 crisis. And it goes across not only the medical people, but also others. Similarly, in the financial sectors, the ease access to credit for households, that's very important. Though our government has announced a 15,000 crore package and 500 rupees is gone down to the farmers and all, but that's peanut because it's a long lockdown and people need money. Trade policy must stay open. You must have seen so many businesses which are being overtaken by China. The Indian export market is being grabbed by them, so it's important. And the way the money power China has now, today's news is that they have got a huge share in the India's leading bank, that is HCFC Bank. And sixth and most important point I would like, which is most pertinent, is boost international cooperation and public-private partnership. Public-private partnership is very important. In India, most of the things what is happening is generally done by the government, and government system is a skeleton system. How to enhance the outreach to 1.3 billion masses, you need to have a public-private partnership. And this is the essence of addressing the current crisis. And if you really see other aspects of this crisis, we have the complete lockdown going on, and the entire supply chain management seems to be stopped. So firstly, what are the essential services that we need to identify? And those essential services, what are they? Like this being a medical emergency, we need to have mobilization of all the health services, all the medical care facilities, testing instruments, testing kits, personal protective equipments, medicines. And you'll be happy to know that in India, Delhi and all the metro cities have become hub. And we have the aircrafts operating under the government directions, and far-flung areas, even Nagaland, Andaman, are being covered. Similarly, the food grain supplies. The government has undertaken a huge control on the food grain supplies, and 6 months stock has been confirmed, and it's mobilized to the last mile. So each state FCI has this much of ability, and that has been confirmed to the central government. So basic two needs, financials, the medical care and the food and supplies has been ensured. Now the next comes is the business. So the business which is threatened, all the essential services business, routine revenue earning business has to start. The biggest challenge in the northern India, what we are facing is the rabi crop, which is standing in Haryana, Punjab, which needs to be cut, and labor is the shortage. So a wire media is being worked out, and government may come out with some relief shortly for harvesting these standing crop and putting them in the storage. Even we have Himalayan region. The Himalayan region, the winter stocking is done now. And fortunately in Punjab, ex-servicemen have come forward and they are ensuring the winter stocking in the higher regions of India, that is the Jammu Kashmir, Himachal and other regions. Even the northeastern region supply is going on. But still, this is not enough. What I'm talking is bare minimum. We need to have mobilized the 21 crore working force which we have, and how this working force has to be mobilized, that is the biggest challenge. So we need to identify which are the medium, how we are going to do. One of the major important thing is the IT services. Most of the good companies have IT services and they have gone for, work from home. But there are services, there are industries which needs to be started. We have a first initiative which has come from state of Punjab, where at limited scale, the industries in Ludhiana, industries in Jalandhar, they have been permitted to start. And one good thing which is happening in Punjab is they are going for testing these people who are there. So after test, once people are cleared, they are being allowed. These are a few good examples which we have to undertake. In South India also, most of the industries which are there, they are locked down and they are working from home. But the major metro cities, especially Bangalore, Chennai, Kochi, they all are under threat of COVID. So as of now, as a precautionary measure, we have to choose between financial continuity or the life. So the government has given priority to saving life, and the more importance has gone on lockdown. In fact, our Prime Minister had a discussion with not only the state chief ministers, but FICCI, the Associated Chamber of Commerce, the big industrialists, the micro SMEs, and a package government is on the workout. And the first thing which has come today is most probably the ESI and EPF balance, which is there, may be utilized by the government in paying salary of the employees in the industry. Because ultimately, an industry will also be able to pay once it has the inflow of money, then only outflow can go. So for 3 months, that plan is being undertaken in India, but the final decision is yet to come. Let's see what comes out from government in next week, because not only announcing the lockdown, the government may come out with some serious measures to have movement of essential goods and capturing the blockade which has caused the blockade of not only supply, but also of the mental health and the stress in the society. So that has a multifaceted impact, and the government is fully seized of the matter. But one thing good was from USA that their FEMA has taken very active role, and we hope that in our country also we can have very active role by the disaster management institutions, and hope they'll be empowered for this. That's all, Tyagi sir, from my side.
Yeah. Thank you very much.
I would like to add, Sanjay, here, like what is happening in the United States, the FEMA has taken over the all the emergency services from the top to the ground, to the city to the grassroots. And that's what the NDMA is meant for. But this is the first disaster, unlike the previous one in India, where the NDMA has not been given the bigger picture, a bigger role, and it is the central government, is Ministry of Home Affairs is directly, and the other Ministry of Health and other ministries are managing. So the NDRF, National Disaster Response Force, which are trained by in biological, neurological, and all kinds of disaster, so far has not been used. Army, they have a lot of potential, they have not been used, and so far. But definitely the suggestion, if somebody, anybody who is a disaster knowledge in the disaster management or disaster experts or disaster accommodations, they will definitely suggest that the NDMA should, at this stage, NDRF should, at this stage, should be used from the grassroots level to the state level, etc., state disaster management authority, district disaster management authority. So that would have been a better model, but so far it has not been used. So that will be our suggestion of this webinar, that they should be given a bigger role, as the role is being like what FEMA is doing in US.
So there is a question from Sanjana Sharma that for logistic in supply chain management sector, any specific input as to segregation and movement of essential and non-essential goods as it involves commercials? Dr. Parvez Hayat, sir.
Yes.
The question,
segregation. Can you repeat the question, please?
For logistic in supply chain management sector, any specific inputs as to segregation and movement of essential and non-essential goods as it involves commercials?
Like initially, I already told you that initially there was a lot of confusion in India regarding the segregation of essential and non-essential. But now, as per the present order of the government of India, they have allowed that there will be both the essential and non-essential items, if and their interstate transportation, that will go on. That is very important for the economy. That's what you said, that like in the US, the central government is given a lot of stimulus, but here is, you see, the very small amount of money has gone to the states, because states are not earning their revenue. So it is, if you go for segregation of essential and non-essential, so again, the people who are so far, DMA and army, etc., who are very well trained to manage, they have not been enforced. Only the local police is the people in the ground. Anywhere you go in the rest, the entire country, you go to Delhi, anywhere, you will find only the police barricades. So what will happen? It will create more confusion. So this is why government had no option but to say that there will be no segregation of essential and But again, what we have to do, we have to see that there are two thoughts. One thought is like in the US, it is the economy and is very important, the economy and the saving of life. Here in India, what our Prime Minister said, that Jaan hai to jahan hai, means it's a life is first. If there's no life, what will we do money? But at the same time, the disaster experts and the economic expert, they have suggested a better model, which I'm sure our Honorable Prime Minister is going to make the announcement on in the last day of the lockdown. That
Dr. Pervez, I would like to make a little intervention here, because we are really, running short of time. And back to the question, when what is required to be, considered as essential and non-essential, there is a state government which, in its own, wisdom and understanding of situation, decided to start functioning of breweries. And this state is heavily dependent on agriculture produce. So no focus on agriculture produce. Wheat crop is ready to be harvested, and no focus on that. But breweries are made operational. So much for paying attention to what is essential and what is non-essential. And when states are required to be making their own decision, this kind of situation is going to develop. But coming back to the point, when we talk about security of and safety of strategic commodity, there have been many questions. They wanted to know what is required to be done as professionals. We are conducting this webinar for the professionals who would be actually implementing take-home points from this webinar. Safety professionals, security professionals who would work at the ground level, grassroots level. And for them, two good doctors have already spoken, and one colonel has given a very elaborate point here. And if there are no further point, I would like to summarize the proceedings. Would it be permitted, please?
Sir, there is one important question. From the US point of view, a young officer is asking, young professional is asking, that when the public-private partnership in India will start, and what incentive can be expected from the government?
As of now, again, there is a lot to be planned and thought of about the policy level. What are the incentives which would be thought appropriate? These are the challenging times. What incentive one can always offer, and which would motivate people to start public-private partnership. In such time, I do not really feel that such considerations really matter. Those people in firefighting, those people in medical profession, those who are on border, they are not looking for the incentives in such challenging times. And in my opinion, and I may be wrong, asking for incentive in such challenging time is not very appropriate thing.
Here I agree with Mr. Tyagi that I don't think there is anywhere any input or any asking from any of the agencies, either private sector, NGOs, they are whatever resources they have, they are mobilizing. I mean, there are many private agencies. Just see, the greatest problem in India is the labor migration. The labor migration, because it was a sudden last lockdown. Now Mr. Sanjay also talked about the standing crops. There's a lot of issue. But recently, day before, Government of India has already issued order that the Government of India is trying to very soon. They are going to announce how to make an announcement wherever the laborers are. There will be, like, for example, the food is sufficient, but now there is another suggestion that those who are migrant labor who do not have the ration card, the government is very soon is going to announce that either any laborers who have rations, they have a card or not, they will be given a ration because there is enough food stock. And there are many experiments to. I don't think anybody is looking for incentive. That's what Mr. Tyagi said. The only thing is that all the voluntary forces, civil defense, definitely they have to be given food. If you just provide food, water, and some direct transfer to their account, whosoever has an account, the Jan Dhan account. So the lot of workforce is required. In the coming days, some announcement is likely to come up where there is a direct transfer to the Jan Dhan account will be made, and the more and more workforces will be mobilized to, to cut the Rabi crop and also to maintain the supply chain. Regarding the other aspect like essential and non-service, definitely essential services, everybody know that now Government of India is also had decided the green district where there is no cases, where all the manufacturing activities maintaining the social distance as much as possible, that is going to be allowed. And also the containment area, where there is a containment area, where there's a highest area, definitely there will be no activities. There will be total lockdown. But majority of the places in the country in Northeast, the Uttarakhand, so just see the Jharkhand, so many districts, even in UP, they have not even a single case or one or two cases. There, most of the factories and industries with maintaining the social distance, and also they have also ensured that everybody has to wear a mask. So maintaining the social industry and all the, so it will, I think it will, the order is likely to come up very soon in this regard.
One of the very important things, sir, I would like, very important point I would like to make here. Mr. Arun Kundu, please stop sharing your screen. One of the very important point I would like to share here, that we got an experience from US. And mind it, US is in stage 4, which is an uncontrolled stage where a battle, a real lifetime battle is being fought. We are just stage 2 and we are in the containment phase. So as Dr. Parvez Hayat has said, that we have the green zones, we have the containment zones marked and focused action, because India again is a big country and we are still in stage 2. So we should not get panicky with what is happening in US. Let's see the situation in what is there in India. Let's learn from the countries which are in advanced stage, what they did when a calamity sort of situation or when they reached stage 4. So we have the advantage of taking the learnings from US, from Europe, from South Korea, from China, wherever the best practices are, whether Singapore, Taiwan, we are adopting that. And based on this, we are very happy that 2 very good things are there in India. One is the political leadership. The Prime Minister's leadership is invincible, incredible. And second thing is the public behavior. Every action depends on public response. If the public responds, then only all government actions can succeed. So the public response in India is good, barring few exceptions. Country has so far done really phenomenal well. And this 1 month period of lockdown, even if we go for a lockdown till 30th April or maybe more, there will be business losses, but the resources, the human resource, our infrastructure, which is more critical, will be saved, and that will always be our bank and asset to again rebuild and restart our economy and the essential commodities. That's all from my side, sir. Tyagi, sir, please.
Thank you, Sanjay. Thank you, Sanjay. There is one good question which has come from Ravi Shankar, and he wanted to know whether there are any specific guidelines for manpower, especially labor engagement in handling distribution and transportation of goods. As of now, Ravi, there are no specific guidelines, and not at the central level, not at the state level, but all district collectors, district magistrates, they are intelligent enough and experienced enough to really identify what is required to be done and what is not required to be done, what is essential and what is non-essential. And they have been issuing passes, they have been issuing permits, and such permissions are not very difficult to get. Maybe the most difficult thing would be to get the workers for such operations. And now, if this is the right time and most
to complement the same, sir, the Government of India has come out with a very clear-cut guidelines for essential services and actions. The letter has come out today. We'll be sharing that letter as part of this webinar in our report when it comes up. But I don't want to read that letter, but a very clear-cut direction has come as far as the use of manpower and especially labor is concerned for essential services.
So that Sanjay will share, when we share with the record of the discussion, we will share, in PDF form, and also the link at the website, which participants and other professionals can go through and understand what we have discussed and what are the implications. And at this point, now may I have permission from the panel speakers to close the session and make little summary of what we have discussed so far and what is required to be done further. Now, since there are no points, I want everyone to focus on the real sequence of action when we talk about supply chain of strategic commodity, from one point where things start moving till they reach the last person in the queue. There are various stages where activities, and as professionals we are not concerned and we are not really very bothered about only the physical delivery. When I say not only the physical delivery, we have to be bothered, concerned, and be responsible for safe and secure delivery of these strategic commodities. There are various people, teams, organizations where they collect the commodity, they pack it, they load it, they transport it, they unload it, and then finally deliver it. The challenging circumstances we are talking about, the COVID-19, where a man, unsafe man handling the commodity will make everything going waste, make every prudent action and very concerned activities go waste. So we are not concerned about only the physical delivery, we are concerned about the safe transportation and secure transportation, where handling becomes more important. So getting the right type of manpower, and that manpower not only from the starting point, at the end point also. As professionals, we have to ensure that entire process, end-to-end process, is safe and secure. Again, as security and safety professional, it is our responsibility to ensure that entire activities are done in secure and safe environment, where technology interventions would be required. There will be scanners, there will be automation of activities, there will be safe transportation. When we talk about medicine, these are not to be only transported just like in any transport. Special vehicles are required, keeping the ambient temperature and humidity under control. So such are the requirements of strategic commodities, which are required to be delivered in time in safe and secure condition. So as security professionals, it is our responsibility to ensure that at ground level, all these things are happening. There is a very responsible and responsive government at the center, and all the states governments have so far been very cooperative, very proactive. And what needs to be done is the last man on the ground is also as diligent, responsible, responsive, and real professional. Then only we will see through the most challenging time which humankind has so far ever witnessed. And with this, I thank Dr. Parvez, I thank Dr. Vijay, and I thank Colonel Sanjay Srivastav and all the participants. And I assure all of them that within a day or two, we will be having the detailed proceedings, entire deliberation, which will be put on record, and the video also will be shared, so that professionally you can use the input from today's webinar. And with this, I thank you everyone here present, and thank you for taking your time and trouble to be present in this webinar, and we look forward to your active participation in future such activities we undertake. Thank you very much. Have a nice day, whatever is left, and wishing you all the best for coming days. May we be very happy, healthy, and safe. God bless us all. Sanjay, I finished.
Thank you so much, sir.
Thank you.
Thank you.
Anything, Dr. Parvez, sir?
Thank you very much, sir.
Thank you, sir. Thank you for participation. And thank you, Vijay, for taking out your time. And so early in the morning, you are up and answering us. And Tyagi, sir, thank you for a wonderful interaction. We end the meeting here, sir.